Hello everyone, so today is the first in the Anesthetics and Perioperative Medicine series, and today we're going to be covering airway management. So by definition, airway management is needed if there is an obstruction or a blockade in the airways which may compromise breathing. There are many causes of this, so risk factors include anaphylaxis, which is an extreme rash, which may lead to inflammation of the tongue, glossitis, epiglottitis, tonsillitis, tumors, trauma to the airway, as well as blockages. So things like vomit and foreign objects and blood can also lead to blockages in the airway. Firstly, we would assess the patient. Now we're looking out for things like the patient being very signs of cyanosis, so very blue, abnormal breath sounds such as stridor, wheeze, signs of rashes, signs of inflammation such as a swollen red tongue, epiglottitis. If the patient is unconscious, we can also listen for sounds such as snoring and abnormal chest expansion. So that's a change in the depth and the coordination of the chest expansion. Now, the first thing we would do to manage is to do two simple anesthetic airway maneuvers. The first includes a head tilt chin lift, and the second includes a jaw thrust. A scenario is if a patient is obese and has a compromised airway, you should, before doing the head tilt chin lift, you should uplift them onto some pillows. And as well, if a patient is vomiting or coughing up blood, you should put them on the patient on the side, and also make sure not to hyperextend the airway too much, as hyperextension of the neck can also conversely compromise the airways also. Secondly, we would then look if the patient airway is not opened up with simple maneuvers. We would then look to use some medical devices such as an oropharyngeal tube seen on the left. So this is a tube that goes down into the pharynx through the oral cavity, or a nasopharyngeal tube. A nasopharyngeal tube will be preferred to an oropharyngeal tube when a patient's airway is difficult to access orally. For example, if they've had a seizure, if they're unconscious. However, risks of a nasopharyngeal tube, which we should be aware of nasal hemorrhage. And then after that, if that still isn't helping to open up the airways, we would then look into ventilation. So that can involve a valve bag mask. And some things we would do to assess the needs for ventilation would be things like a low O2 saturations, poor depth and coordination of chest expansion, signs of cyanosis. So all the things I talked about in the first slide: stridor, wheeze, and ABG showing end-tidal CO2 and O2 volume. And then again, if there is no signs of improvement in the airway management following a valve mask, we would then escalate to a senior, for example, trying a laryngeal mask. And if not that, still not helping, we can then use endotracheal intubation. Thank you for listening. That was a basic introduction into airway management. If you have any questions, please comment down in the comment section below. Thank you.